Chronic sciatica pain might be ruining your life right now. I have helped hundreds of clients overcome this, and here's what we usually work on to help them with it. A small percentage of cases will be coming from disc or nerve root issues in the spine. Recovering the natural movements of your spine is really important. Here's how we like to do it. A typical sciatica client has been bracing quite strongly through their back, so I find it really important to move their back into flexion and extending or bending forwards and backwards in a number of different positions, both in sitting, standing against the wall. We can include weights if we need to, in all four positions, and even in prone to extend through your lumbar spine again. That can be really important to recover. And we also need to be able to side bend through the spine through different ranges of motion. We can add reaches here and also to rotate cleanly through that area. Start small with every one of these, progress gradually as your symptoms allow. It's normal to find yourself bracing around this area when you have sciatic pain, although doing so may contribute to compression on the sciatic nerve deep in the back of your hip. To create some space here, I love a well executed hip hinge to drive some hip flexion and hip internal rotation. Being able to move freely from that hip flexion to hip extension, from hip external rotation to internal rotation, is key to create some space at the back of the hip here. If you find yourself bracing around the back of your hip, do your best to relax those tissues and move freely. It's also important that the sciatic nerve itself can move. There's quite a lot of mobility for the nerve within its sheath, and by mobilizing it, you bring blood flow to the nerve, which keeps it healthy and functioning normally. Start with a simple slider glider progression here. Slouch, keep your head up, point your toes down, and move the leg in and out. For a harder variation, keep the head up, slouch, pull the toes towards yourself while you flex and extend. To make it a little bit harder, head goes down, toes go down, and the hardest is to bring the head down and the toes up towards you while you straighten the leg. It can be normal at the start if you're shaking at the top of the range here. You must minimize the fear, worry and concern as much as you can. Stop reading everything on Dr. Google about sciatica. It's not helping. Cut out the worry warts in your life that make you doubt your ability to recover. The more belief that you hold in your recovery, the more likely you are to make a full recovery. Making sure your sleep is on point, minimizing stressors wherever possible, gently moving your body every day, using pain medication when it's appropriate for you. If you're not nailing these basics on a daily basis, your intrinsic pain control is going to be much less, leading to higher levels of symptoms. Nail the basics as much as you can every day. It will really help your recovery. From the get-go, frame your expectations realistically. It can take anywhere from 8, 10, 12 weeks to even 12 months sometimes to settle this down properly and rebuild your confidence and movement again. These are the basics I usually work through with people who have sciatica. Obviously in this format I can't provide one-to-one assessment to see how your previous injuries and your own story contributes to these symptoms. If you need that help, find someone you can trust. That will make all the difference. If you found this content useful, please drop me a follow. I'd really appreciate that. Please send it to someone who needs to see it and save it for your own use in the future. Cheers.